Now let us get into the ovarian neoplasm. Or ovarian tumors. They can be classified into the following types, which is surface epithelial tumor, germ cell tumor, sex cord stromal tumor, and metastasis. Now under each heading we have got the following. Surface epithelial tumors can be further divided into 5 types, which is serous, mucinous, Brenner's, also known as transitional cell carcinoma or transitional cell tumor, clear cell carcinoma, and endometrioid tumor. Now, germ cell tumors include the following: dysgerminoma, which is the counterpart of seminoma from testicular tumors, and choriocarcinoma, yolk sac tumor, also known as endodermal sinus tumor, and embryonal carcinoma. Then teratoma, ovarian teratoma. Sex cord stromal tumors include granulosa cell tumor, Leydig cell, Sertoli cell, fibroma, and thecoma. Metastases include only one, which is Krukenberg's tumor. Now let us dive into the surface epithelial tumors, which includes the 5, and let us see their common features. They are the most common cause of ovarian tumors, and they involve the surface. That is why it is called as surface epithelial tumors, and each of them, every one of them, are CA125 positive. And they can be generally divided into 3 types, which is benign, borderline, and malignant. Most probably the first 3 can be divided into benign, borderline, and malignant. Now diving into the differences between the first 2, that is serous and mucinous. So, serous is more common, whereas mucinous is less common. Serous is bilateral, whereas mucinous is unilateral, which can be called as mono, so that it matches with the M. Then the risk factors are, wait, let us finish the histopathology and gross. So beginning with the gross, it is uniloculated. That it looks like it has only a single room and it has serous fluid. Whereas this one looks like it has more rooms, so it is multiloculated and has mucinous fluid. With the gross over, going to histology. Histopathological examination shows ciliated columnar epithelium. Here, tall columnar cells with apical mucin. Now going to the genetic causes, it can be involved with BRCA1-2 gene. BRCA1-2, this is involved with KRAS mutation, and risk factors include family history and nulliparity. This includes risk factors smoking. And now Samoma bodies. Samoma bodies are the foci of dystrophic calcification. It is an important feature part of the histopathological examination, so it is present here and absent here. Samoma bodies are also seen in papillary carcinoma of thyroid, serous cystadenoma of ovary, melanoma, and prolactinoma. It has got a mnemonic. PS में MP देखो. I actually don't know Hindi, but it has been given like that. With that, the serous and mucinous tumors are over. Moving on to Brenner's tumor. Brenner's, also known as transitional cell carcinoma or transitional cell tumor. Brenner's tumor includes benign, solid unilateral, and yellow. Microscopy, that is histopathological examination, shows nests of cells divided by septa. The septa is not important right now. It has bladder-like epithelium which is transitional and has coffee bean nuclei. So B, coffee bean nuclei. So coffee bean nuclei is basically seen in we will be seeing a granuloma, the here granular cell tumor and Brenner's tumor. We will see the whole list later. Moving on to clear cell carcinoma. Clear cell carcinoma is involved in mothers who take diethylstilbestrol. Diethylstilbestrol, which is an oral contraceptive during pregnancy. Their daughters are affected by clear cell carcinoma. Now, going on to endometrioid tumor or endometrioid carcinoma. The risk factors here are endometriosis, that is nothing but chocolate cyst, includes chocolate cyst, P10 mutation on chromosome 10, and ARID1A gene mutation. With this, surface epithelial tumors get over. Now we will move on to germ cell tumor. Germ cell tumor involves the first one, dysgerminoma. Dysgerminoma, gross appearance, gives cut potato appearance, and histopathological, that is microscopy, shows nests of cells with fibrous septa. Septa has lymphocytic infiltrate. And the individual cells give central nuclei with perinuclear clearing. This perinuclear clearing is occurring due to deposition of glycogen, and the whole appearance gives fried egg. Now going on to immunohistochemical markers, which are PLAP positive, lactate dehydrogenase LDH positive, HCG positive, but alpha fetoprotein negative. Newer markers are going by 1, 2, 3, 4 and 5. One, two, three, 4 and 5 markers. This is dysgerminoma. Now the new markers are CD117 or c-KIT, D240, OCT3 or 4, SAL4, nano 1, 2, 3, 4 and this is a 5-letter word 5. So these are the new markers. With this, dysgerminoma is over. Now moving on to choriocarcinoma. Choriocarcinoma occurs in the elderly. It is an aggressive tumor and has metastasis, which is cannonball mets in lungs. Gross. Gross shows hemorrhage and necrosis. Microscopy shows cyto and syncytiotropoblast. Cytotrophoblast is uninucleated, whereas syncytiotropoblast is multinucleated like a giant cell, and no villi is present, which differentiates it from the actual placenta. Immunohistochemical marker beta HCG positive. Now moving on to the next one, which is yolk sac tumor or endodermal thymus tumor, which is the other name. It occurs in, so yolk sac is majority percentage children, so it occurs in children, and microscopically it shows Schiller dual bodies or glomeruloid body. Glomerulus is characterized by presence of capillaries and layer of cells with a space, then layer of cells. So Schiller dual body is also the same. It has central blood vessels, then surrounded by one layer of cells, then a gap, then another layer of cells. It looks like a glomerulus, right? So it is also named as glomeruloid body and also contains hyaline globules, which is eosinophilic. Now, these Schiller dual bodies are also seen in here it is yolk sac tumor, also seen in glioblastoma multiforme, that is a neural tumor, glioblastoma multiforme. With this microscopy, we move on to immunohistochemical markers, which is 2A's, alpha fetoprotein and alpha 1 antitrypsin. Now with this we move on to embryonal cell carcinoma. This one on histopathology shows pleomorphic cells with papilloid configuration. With immunohistochemical markers CD30 positive and CK positive. Now moving on to teratoma. It has more than or equal to 2 germ layers. And a mature cystic teratoma is called as dermoid cyst, and this contains a Rokitansky protuberance and a Rokitansky protuberance is important because it must be done microscopy to know whether cancer cells are present in it or not. With this we move on to the types of teratoma, which is mature and immature. A mature teratoma is benign, whereas immature is malignant. There are no primitive elements. whereas primitive elements are present in immature. Here, completely formed elements like bone, hair, skin, nails are present, whereas here it might be looking like a small round blue cell tumor. On microscopy, we see the different structures like skin, hair, nail, etc. Bone, cartilage also. Now, there is a special type under teratoma which is monodermal teratoma. Teratoma in general means more than or equal to two germ layers involvement, but here only one germ layer involvement. Example is struma ovary, which is nothing but thyroid in ovary. You can find the thyroid follicles on microscopy, and gross examination of the struma ovary gives differential diagnosis on endometriosis or otherwise called as chocolate cyst when found in an ovary. With this we complete germ cell tumors. Now moving on to sex cord stromal tumors. Under sex cord stromal tumors, we have got granulosa cell tumor, and let us begin with that. Before that, there is a common feature which is Dicer1 gene mutation. Dicer1 gene mutation is common for all these tumors. Now moving on with the first topic, which is granulosa cell tumor. Granulosa cell tumor is found in the elderly, that is post-menopausal females, and involves the gene mutation FOXL2 gene mutation. There is an increased level of inhibin, and there is CD99 positivity. On gross, you can see a yellow tumor, whereas in the blood you can find increased estrogen levels. Increased estrogen levels contributes to the following: endometrial hyperplasia, and in old females this is not right, so it may lead to endometrial carcinoma. Also, precocious puberty when young. Histopathological examination shows nests of cells. Also, Kohl-Exner body. Kohl-Exner body looks like a granulosa cell, that is pinkish material surrounded by cells, and coffee bean nuclei, pinkish material, and coffee bean nuclei. Now, as already told, coffee bean nuclei is also seen in, we will be discussing later, I have told. Now let us have a look at it. Coffee bean nucleus is also seen in, otherwise in total seen in 5 conditions in pathology. They are papillary carcinoma of thyroid, Langerhans cell histiocytosis, Brenner's tumor, chondroblastoma, and granulosa cell tumor. With this, coffee bean nuclei is over, and also the granulosa cell tumor in whole. Now moving on to Leydig cell tumor and Sertoli cell tumor. These cells are actually found in the male reproductive system, but in females, when it occurs, it causes masculinization. So, on histopathological examination, Leydig cells show Ranke's crystals. They look something like this rectangle shape or coffin lid shaped, and Sertoli cells shows inhibin increase. With this, we move on to fibroma versus thecoma. Now, fibroma and thecoma, both of them are solid and unilateral. Also, Brenner's. Brenner's is also solid and unilateral. Now, histopathological examination shows here spindle cells, and it is dense fibrous. This one has fibroblast and lipid droplets. Which is nothing but vacuolated cells. Gross examination has got white, here it's yellow, and marker is vimentin. Here it is oil red O. Now this whole story can be summarized with another story of granulosa cell tumor. Let us see that in the end. Before that, we will see Meeks syndrome and pseudo Meeks syndrome. Meeks syndrome and pseudo Meeks syndrome. Let us go with the body cavities, which is pelvis, abdomen and chest. Pelvis, abdomen and chest. In the pelvis, ovarian fibroma is seen. In the pseudo Meeks, any pelvic mass other than fibroma. In abdomen, we see in both ascites, and in the chest, right-sided hydrothorax. Now, moving on to Krukenberg's tumor. Krukenberg's tumor is diffuse gastric adenocarcinoma. It gets metastasized to the lungs, to the ovary. These diffuse gastric adenocarcinoma shows signet ring cells, and these can also be seen on Krukenberg's tumor. So, on histopathological examination, you see signet ring cells. On gross examination, you see that it is bilateral, symmetric enlargement, and the capsule, it is intact. And E-cadherin loss. E-cadherin loss is seen in diffuse gastric adenocarcinoma, and lobular carcinoma of the breast. Now let us see the story before looking at the combination tumors. The story for granulosa cell tumor is that 99-year-old granny became hormonal. So she called her ex for coffee. This is to be inhibited. She is clever like a fox. So the things are CD99 positivity, so 99. The granny is granulosa cell tumor. Hormonal. Hormonal is increased estrogen, so hormonal. And call X is call X in our bodies. And to be inhibited, so in rise in inhibin. And she is clever like a fox. So fox is FOXL2 gene. This is a story for granulosa cell tumor. And with that, we go on to the combination tumors. The combination tumors are sertoli-Leydig, fibrothecoma, and Brenner's tumor, along with mucinous tumor. This is for easily taking a screenshot. With this, ovarian neoplasm gets completed. Thank you.